Hey, what's going on? It's Dr. Ganatra. So I got a question for you. How do you actually diagnose compromised tissue quality? You know, you want to start doing more grafting procedures in your practice, or you're looking at some areas in the mouth and you're like, gosh, this isn't looking too good. How do I tell the patient that? How do I even diagnose this clinically? Well, that's what Dr. Ziv Simon is going to show you today. In this session, he's going to walk you through a step-by-step process to diagnose compromised tissue quality. So you'll hear him think through this process, and he's going to give you a simple step-by-step way to diagnose this with all of your cases. So let's just jump right into it.
The tissue quality is an issue, and many dentists are having a challenge in diagnosing. And if you don't diagnose, you can't recommend treatment. Okay, so the first step in diagnosis is finding the border. What's the border? It's the border between the mucosa and the gingiva. The gingiva is the more robust, keratinized, dense, full of collagen tissue that is closer to the teeth, to the CJ. The mucosa is full of elastin. It's stretchable. It's very vascular. These are two distinct tissues that you need to be able to identify. By the way, that's going to be also our first incision in the procedure. So make sure that you're able to identify the border. Simple, grab on the lip or grab on the cheek, wiggle it around, see which tissue is moving, which one is not. That's the border. So try to identify it. Sometimes or often you see a very distinct color difference. So step number one is find and identify the border and understand it. Step number two in the diagnosis is figure out the quantity. How much gingiva? Do we have a lot of it? Does the patient have robust attaching keratinized tissue, 3-4 millimeters? I've seen some, superhuman patients, but the patients that end up with me or end up with you with a gum concern, they don't have it. So measure it. Measure how much keratinized tissue they have. Is it 3? Is it 2? Is it 1? Is it 0? Okay. The less they have, the more the need for a graft is. Remember, this is a graft for soft tissue quality. So if there's 0 gingiva, no gingiva at all, it's all mucosa, all the way to the free gingival margin, like you're seeing here on this lateral incisor. And there's a pulling element, okay? Tissue quality problem and a pulling element. Treatment is not optional. It's not something you want to think about. It's not something that you want to present as an optional treatment or elective. It's not elective. It's a necessary treatment for health reasons to preserve the natural dentition. So by doing this procedure, by first of all diagnosing it and executing it, you are saving the patient's natural dentition. That's how I'd like you to present it to the patient. It's not elective. Okay, that defect needs to be grafted, and we're going to learn how to do it. But I want you to first of all be convinced that that is necessary. There are pulling elements that need to be removed, and the tissue quality needs to be grafted. The recession, because we are thinking always about recession. How am I going to fix this recession? And the patient as well. I have the recession. How am I going to fix that? Okay, time out. Recession is secondary. And I'm not saying recession should not be treated as not important. Great part of my practice, about 50% is recession treatment. And that you can learn as well. However, priority here is tissue quality. Secondarily to that, it's recession that can be treated to some extent. So treatment is not optional.
All right, wasn't that awesome? If you like this video, let us know what you think. All right, wasn't that awesome? If you like this video, let us know what you think in the comments. And most importantly, make sure you check out Dr. Ziv Simon's free soft tissue grafting training. You can find the link in the captions below this video. It's totally free. It's a full session with Dr. Simon going over soft tissue grafting, going over all the step-by-step sequences involved, and how you can integrate more of these procedures into your practice. As always, I'll see you on the next one, and live inspired.